we have a birth group that a lot of us are very involved in. And some of the concerns we do hear is they don't feel like they're being heard by their provider. So, one of the things, if people are feeling that way on top of already being uneasy with COVID and the pandemic, is, ask very direct questions. And if you still aren't being heard, get a second opinion. There are many providers around. I don't know how easy it is. I'm not in that position right now, but try to find a second opinion and be heard, and actually somebody listening to you and answering your questions makes the difference. And we've seen that too. Some people go in with have some questions and forget, and so they're not answered and they feel like they're not being heard. But write these questions down, be very direct, even with the nurse when she's checking you in. Say, hey, I have some extra questions today for the doctor, so they're prepared and they know, and write it down, and write down their answers too, because it's a lot of information to take, especially if you're alone without a support person with you.
I have a somewhat related story from my sister. She was diagnosed with endometrial cancer. She didn't have insurance. She had some less than stellar care before she finally got her diagnosis. And so they scrambled to find someone to care for her. So she got care through an indigent program with the state. She ends up in an oncologist's office, doesn't know this person, has never met this doctor. And the doctor looks at her and she says, so tell me about what's going on with you. And my sister said, well, wait a second, you're the doctor. You're supposed to know all about this stuff. And the doctor said, yes, I've read your chart. She says, I want to know what you know. And I thought that was the most brilliant thing ever, because one, she's giving her patient the floor to talk to her. And two, she's going to learn a lot about her patient in that, 5 minutes that she's going to have her listen to her patient. And if you're a provider and you spend all your time talking to your patient, you should probably find a way to give them, demand that they talk to you, encourage them to talk to you, and listen really hard to what they're saying.
Now, I can tell you with some medical stuff that happened to me this year, I went to my doctor, did a bunch of testing, did all stuff, and my doctor could not figure it out. And basically it was kind of like, and I was like, something's going on and I want this figured out. And when she wasn't really helping because she really just didn't know, I was like, well, what do I do now? And she's like, well, we can run tests again and we can, and I was like, something is happening to me, like, but what is it? And I need to know. And so I actually asked for a referral, and I would have never asked for that before, but I've learned from past experience, sometimes a doctor's scope only goes so far, and then we need to go to somebody else that has other information that this doctor just doesn't know. Maybe they've just never seen the situation before. So I asked to be sent to a specialist. I asked to be checked out by someone else. And to be honest, I kind of felt like I was like, oh, I might be a little bit rude. I like my doctor, but me asking like something's wrong and you're not helping, I need to go somewhere else. She actually said, where would you like me to refer you? Do you have a doctor name? Do you want me to find you a doctor? And so I did some research and she did some stuff, and she was checking in and asking other doctors. And the thing is like, if there's something going on, you have to stay on it. Like, you have to, because they have so much going on. And I think it's okay for you to ask for a referral. It's okay for you to say, can you send me to someone else? Or what are my other options? Instead of just staying like stuck and then being like, oh, well, I guess it's not that important, when you are important. It may lead to nothing, but then again, it might lead to something that maybe you do need treatment, or it's leading to something that you can prevent from getting worse. The thing is that if something's bothering you, something's going on, I think that we need to take it more upon ourselves to like really dig for the answers, dig for whatever. And I've noticed some of my friends that have been pregnant, have had little issues. Maybe they're worried about their baby, and it's almost like they're scared to call their doctor. They're scared to like just call the question, is this normal? Is this not normal? And I think we see a lot of people online asking questions where it's like, call your doctor, just call your doctor. Like literally, I feel like sometimes that's pretty much almost every message that I write on Facebook is call your doctor, please just call them. And it's okay to call them. It's okay to get on the phone with the nurse line, and you know, it's okay to set up an appointment and say something's going on and I don't know if this is normal. And I think it's okay to also ask for a referral, to ask for a specialist in certain fields or whatever. So I think that is, it's very, very important to just, if something's going on, just dig deeper into it, ask for it. And a doctor, especially a good doctor, is going to be like, yes, I don't know. Here, let me send you to somebody that knows, and we can figure this out together. Because that's what my doctor was totally like, yeah, go ahead, send me to somebody else, got their opinion, because it's okay. You can get a second opinion. If you don't like that opinion, get a third opinion. It's okay. Just keep searching till you get the answer that of actually what's going on. And that was something, that's a learned thing, because I think before I would have never, ever probably asked for that. I would have never asked for a referral. I would have never been like, send me to another doctor. But now with my experience of what's happened, if you feel dismissed by the nurse, the doctor, anybody, you need to have somebody else that's going to actually hear you and realize, yes, there's a lot going on right now with COVID, but also there could be a lot going on with you. And I think we forget that. And especially if you're pregnant, or there's things going on, or your child, there's things that's going on with like little kids and people are afraid to call the doctor. Just ask the questions, get out there, say, I'm not sure, something feels off. It's okay to follow. There's your instincts that the home birth community says, follow your instincts. With that, keep searching for the information that you need to find for your family, for the well-being of yourself and for your family. And I think that's very, very important, is that we need to keep asking the questions until we get the answer. It may take a little bit, but just keep asking, and definitely get referred, go to someone else, go to a specialist, or always call your doctor. Please just call your doctor.
And I think it's important to note too, I know with pregnant people in the postpartum period is already hard enough on a new mother. And their, like I said, their mental health. So I know with COVID, there's a lot of apps, like therapy apps or just counseling apps that you can reach out to. But I know it's very isolating having a newborn on top of living in a pandemic with a newborn, and a lot of fears that these new mothers have. And that is one big concern. So I don't know how easily accessible in-person care is, but I know with having a newborn, it is nice to have those types of options through your phone app, or, you know, telehealth appointments now too. So that's something a lot of people, even pregnant people, suffering some depression or just want to get set up before, if they've had previous issues with or previous depression or any of those issues, you can set that up ahead of time so you are prepared. But it is very isolating, let alone with a newborn, but in a pandemic too.
Well, I think that's the main thing, that for anything of when we're doing the topics, I think we do need to think about self-care, because we do have a lot of women that go into postpartum depression and don't even know, and they don't get help. And I think that happens, like, we feel unheard during pregnancy and we don't get help. There's certain things that maybe we can be paying more attention to, and, you know, that kind of thing. So I do definitely agree that we need more self-care, more support. There needs to be more support lines out there. And I think this is the time that things are going to change, because now since we have the internet and we're doing a lot of things more online, more, you know, more media, more face-to-face like this. I think things are going to change medically. I think things are going to change support-wise. I know a lot of people went from just therapy sessions, like you would go get on the couch with your therapist. Now you're talking to them like this. You're literally seeing them face to face at home, at the comfort of your home. They're at the comfort of their office. They're not exposing you, you're not exposing them, and it's great. And I think a lot of things are going to change in that way. And in some ways, as much as it's isolating, at least we know we're so connected. So I do like the new reaching out, because we can reach each other, like no matter where you are in the world, we can see each other. Other than it does get really isolating and alone other than that time. So I do think this is it's time for our new lives, because this isn't going to stay the same as how we were so connected to just go out of your house and go meet your friends at the park, or, or story time with your kids, or, set appointments with certain people and you can bring them all with, and everybody jumps in and goes to your doctor's appointments. But I do think that there's going to be a lot of changes, but I think the main focus is safety. Even with COVID or whatever, we've been safe of COVID, but other stuff too. You have other health stuff going on, be safe with that too, and do what you can, because we know that care is not going to be that great going into the ER right now for other situations too. Like if you have a heart problem or other things going on, but do what you can through this, and hopefully we all get through it together.
Stay safe, wear a mask, wash your hands, and social distance.